The CEO of GoFundMe said that 1/3 of all campaigns for donations are medical. So we're going to take a look from their website, because when you say 1/3, it doesn't give you an idea of the scale of this mess in America. Okay, the results: 4,682,774 results found. America, 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 America. Show more. Cody's medical bill, 73,000. Addison's, no, Addison, Texas, 41,000. Yeah, this is ridiculous. All the other Western developed nations have single payer healthcare except for U.S. And Medicaid covers the poor people. So if you're poor, your basic needs are covered. You get food stamps, um, sometimes disability, you get Section 8, Medicaid, um, WIC. And if you're rich and you can afford to pay cash, it doesn't matter. The third one might be if you have great insurance, and insurance um, has a low deductible. This one's 16,000 raised, 7,000 raised, 7,000 raised. Okay, I don't think the long cross is from the U.S. Nope, this one's in Europe. You can tell from the police car in the picture. There's an article on Times from January 30th, 2019, and it says nearly 250,000 campaigns have been set up on GoFundMe for healthcare costs, raising $650 million in contributions. There are a lot of Americans that argue we don't want big government in our healthcare, but government is already there for Social Security, for police stations, for fire stations, for schools, for disability, for Section 8, for food stamps, for our army, our military. So that argument doesn't make a lot of sense. And there are people that say, you see Canadians and you see people all around the world come to the US for healthcare. Yes, America does have the best healthcare in the world. And the people that come are usually better off. It's not everyone coming to the US for healthcare. A heart surgery in India costs, I believe, $1,200. In America, it costs, I believe, around $120,000 to $200,000. And the ER costs, I went to the ER after I fell off a bicycle, and it costs $1,500. And after insurance, I paid $1,000. And that was for a small cut on my ankle. And there are articles online about the air ambulance charging $25,000, or I believe $50,000 for transportation, because the insurance would not cover it. And after negotiations, she did manage to get it down, but it was still quite a lot of money. And on Quora, you could find a bunch of stories, horror stories, of people going bankrupt for medical care. In 1940s, the child delivery cost in hospitals was, I believe, 1%, 1.5% of income. And in the 1970s, it went up to about 15% of income. And now it's around 20% of income. And if you watch the documentary by Michael Moore called Sicko, Sicko, uh, it talks about people in America struggling to afford healthcare. And another one is Democracy on the Brinks. It talks about the corporate influence, especially the insurance and healthcare industry influence on the government. And if you go into a Walmart, you see these children's hospital donation boxes. What I start to wonder is if no one could afford it and we're already struggling, where does that money go? Because when we're struggling and we're already putting so much money in to our healthcare, it just doesn't make sense. Something doesn't make sense. I encourage everyone to research this subject more and vote or do something, because what we have now in America is not working.